Hello, everyone. This is Jose Lopez, Dr. Lopez, if you want to call me. And I want to welcome everybody to group counseling. Just a couple of things. Group counseling officially starts on the 14th, so that's tomorrow. But I've opened the class up since last week. I know we've had a little bit of issues with discussion boards, and the date wasn't right. So thank you to those of you that had contacted me about that. I do apologize. And I appreciate the emails and the questions, and also kind of the introduction. Just a couple of things, right quick. Like I said, my name's Jose Lopez. I'll be the adjunct professor for the group counseling class. This is a 100% online class. There are two components. There is the lecture component, and then what we call the lab component. The lab, I saw on Blackboard that it also has a link. I will not be posting anything on the lab just to keep things as simple as possible. So everything will be posted on the lecture. But I do need everyone to get the 5 hours of their group experience, which will count as your lab grade. And just to I know I'm leaving Dr. Timothy Sneed's videos as well because I think he did a great job with his videos, and I'm using a lot of his content. So you're actually going to have both my videos and his videos. I hope that doesn't confuse anyone, and if it does, just let me know, and I'll be happy to take them down. But I think he did a really good job with his videos, and I just want to supplement my lectures to go along with his. So, please read the syllabus. I think it's pretty self explanatory. I did get some questions about the textbook. You don't need the lab, you just need the Corey textbook on group counseling. So I just want to make that clear. I know, I believe in the bookstore, some people said that the supplement was, they were telling them that that was a requirement. And I think what happened was that in the group lecture it is a requirement, but because this is an online class and I wanted to save everyone a couple, save them some money, I just want to keep it as simple as possible. So that was kind of my philosophy behind it. Please don't tell the bookstore or argue with them. Just kind of let them know that you appreciate their information. Okay, well, like I said, I'm Jose Lopez. This is my second course teaching out southeastern Oklahoma. I'm so excited to be here. I gave you a little bit of my introduction as far as kind of where I'm coming from. And just to let you know, Dr. Sneed and I were good friends. We actually graduated together from A&M Commerce. So we've known each other for quite a while. We've taken doctorate classes together. Really good guy. So, that's why I wanted to have his videos up because he's actually a full-time professor here. I'm just doing adjunct. So my full-time job is actually as a school counselor for Dallas Independent School District, where I'm just doing this on a part-time basis. And just to let everybody know, I because I work full-time as a school counselor, I mainly check my emails and post stuff in the evening. So if I know with hours and everything, people have different work schedules, but just be patient with me. Usually, I try to reply to all the emails in the evening as well. And if you don't hear back from me, our wonderful academic coach, she's here to help as well. So be sure to. She's actually your first point of contact. Because we have a great numbers. I believe 52 was our last count. We have, or me, the academic coach and I will be working collaboratively to help all the students. In theories, I think we had like 38 and we didn't make the cut for an academic coach, but I'm so glad that we have an academic coach for group counseling. Okay, so I don't want to make this too long. Just a little bit of background on me. I mentioned that I'm a full-time school counselor currently, and this is adjunct part-time. Um, my background really is in language and how language is used in counseling. As far as my group experience, most of my groups have been in the schools. I love doing groups in schools. And one thing that I was going to say is that I think what is so important about groups is that you can really impact people by a multiple. So, for example, just reading your intros and just kind of looking at how people talk about themselves and things like that. One of the things that stood out was a lot of the students that I read, they want to impact change. They want to impact change for the better, which by all means is great. That's inspiring, and that's kind of why I like to do this. But when we think about change, let's say an 8-hour work week, if you're just doing individual or family sessions, 8 hours a day, 6 hours a day, with break and some of the other consultations and whatnot that full therapists do. You're talking about maybe 6 families. If we're talking about groups, 6 to 8 groups per session, you can multiply that by, have close to 50, 60 families that you're impacting a day. So just the notion of doing groups can really multiply your impact as a counselor, as a therapist. And I think that's why groups are so important in institutions, MHMR, schools, nonprofits, hospitals, all those institutions, I think, apply a lot of these group practices because they're so impactful, and one counselor can make such a bigger impact than if they were working individually, or if they were doing, well, even if they were doing like couples or family work. So groups are really important. I love to do groups. This semester at my school, I'm actually doing 4 groups. I have a social emotional learning group. I have a study skills group. I have an anger management group, and I also have a friendship group. And in addition to that, in addition to running my school counseling program, I also have a kindness and compassion after school club, which I guess I could consider a group. So for me, learning about Corey and Corey, Mr. and Mrs. Corey, as a master student, I thought that was kind of, if I can give you the gist, that was kind of why it's so impactful, because in a school of 600, and there's only 1 or 2, well, you'll look if you have 2 counselors, but 1 counselor, how are you going to make the biggest impact? How are you going to get the most bang for your buck? And by that, I would say guidance, groups, those are kind of the things that I would consider the tier 1, tier 2 interventions. So, just a little bit of background about kind of my day to day. And like I said, my specialty has been in language, and part of language is understanding the dynamic. So let me just go quickly through. I know Dr. Sneed's video mentioned a lot of this, but let me just give it to you in a different way, or just a different voice. That way, the more information you're being exposed to, I think the better, the more success I hope that you'll have in this class. And I want everybody to be successful. Obviously, I don't do this for the money. To be honest, they don't. It's not that much, but I've been helped by many professors, Dr. Lampy, Dr. Robinson, great professors that I had, and if I can give a little bit of what I've received, then that's certainly my mission. Chapter 1, Introduction. Let me just give you some of the highlights. Brief group work. A lot of the schools, institutions, hospitals implement that, and what that means is just 3 to 5 sessions. Just let me give you the gist. Let me give you the kind of the main points of views, a little bit of processing, kind of expose you to a lot of the materials. But really, when we're talking about brief, we're talking about 3 to 5 sessions. We're not going to get into a lot of the deeper things that a group that maybe meets 6 to 12 months will get into. But I think what's powerful about a brief group is that you're really exposing them to the content. And, for a lot of young kids, I think it's important to expose them and make them aware, for example, of how emotions affect behaviors and vice versa. So, maybe I don't, it's not feasible for me to do a year-long group, but if I can do a brief group and I can intervene a little bit year after year after year, then long term I'm going to see results. And I think that's, as a profession, when we talk about data-driven results, I think that's something that school counselors as well as community counselors need to advocate. That even though this brief group may not show immediate results, the exposure, the vocabulary, having them grasp some of the concepts little by little can be really a cumulative thing for them. And a lot of times when I'm in a group, I have kids tell me, I was in a group last year, and I tell them, great, little by little. We're not expecting big changes, but if we can do small steps, that can accumulate into a big positive step. Group counseling, that just means you have a group of 2 or more individuals who are trying to work towards a purpose or trying to have a certain mission that they're trying to work through. And this really started with World War One and World War Two. Back in the early 1900s, there was a war, and a lot of soldiers were coming. There wasn't enough therapists, there wasn't enough psychologists to work with them, so it really became an issue of putting them together and having them work through a lot of their shell shock, PTSD, things like that. And even today, I have a good colleague of mine who's working at the VA in South Dallas, and she does a lot of groups, and it just really tells me about a lot of what these veterans are going through. Another term I want you to be aware of is group psychotherapy. Psychotherapy just refers to the psychology of a therapeutic intervention. So a lot of times counselors refer to themselves as psychotherapists. That just means they're using psychological interventions as a means of helping another individual. So don't get confused by the terms. It's important to educate clients about the different terms. So I always make sure that as a counselor in training, you're aware of those terms. And also be aware that a lot of people, especially minorities, they may not know the difference between a counselor, a social worker, psychologist, or psychiatrist. So be sure you're able to explain the differences of the different helping professionals. I think that's important and very much confused. The next one is multicultural counseling. When we talk about multicultural, I always like to include multilingual. A lot of times, people come from different backgrounds, different languages, religion, gender, d- location, socioeconomic, age, all that, counselors need to take into account. And so just be mindful of that. Be aware of your own biases. Be aware of your own backgrounds. Be aware of how others may influence you and you influence them back. I can give you an example of something that has happened to me recently where I've worked with clients who've had very much different political views than I've had, and one of the things that has really helped me is in putting myself in their shoes and helping myself really understand kind of why their philosophy is the way it is. And I really, I appreciate that. I'm very thankful for that because 10 years ago, I don't think I would have had that notion. I don't think I would have had that background or able to say, I'm patient enough to hear you out. So yeah, multicultural, super important. I'll be talking about that. I think it needs to be talked about more. It's not enough to just say multicultural. It's all about the application, and you know, in even not that long ago, maybe 2, 3 generations ago, minorities really were prohibited from attending colleges. They were prohibited from seeking these degrees. And people wonder why there's a lack of diversity in at the university college level. So, it's really a shame that institutions have for so long discriminated, and that has really impacted many fields, including the counseling field. Psychoeducational groups. These are groups that are very structured and present a topic. So, for example, in my school, I have parental, you can call them classes. I like to call them psychoeducational classes, where I present on a topic. Last month, I presented on discipline styles. This month, I'll be actually, this week actually, I'll be presenting on love and logic to parents. So, for me as a school counselor, not only do I like to work with the children, but I also like to work with the parents because I think we need a partnership, and a lot of times we need help. So bringing the parents in, teaching them skills that they can use in order to help the child, etc. And finally, task facilitation groups. This is another type of group in which we're teaching a lot of social skills. So, I can think of at the elementary campus how to make friends, how to be a good friend, how to express your feelings. You're looking for a specific task that you would like, and you're showing them specifically how they could be successful in that task. Okay, so just very quickly moving on to chapter 3 of ethics in the Corey book, just to highlight some things. Competence, that refers to what the counselor has training and or feels that they are within their scope of knowledge. So, for example, if somebody is doing a group and they're not trained in, let's say, sand therapy, or they don't feel like they have the skills, but then they just buy the kits and then they just kind of wing it, I wouldn't say that their competence is at a standard level of the field. Confidentiality in a group that is very difficult. One thing that I say about when we talk about group norms, especially at the elementary small age level, is I say that I cannot possibly guarantee confidentiality, so only talk about what you're comfortable talking. Now, in an individual setting, that's different, right? Because it's one on one. But even with a minor, you have implications because parents can always access the records. So I always tell them about the limitations of confidentiality. So be sure to read up on that and understand kind of what the limitations are and why confidentiality needs to be very clear to everyone in the group. Countertransference as well as transference and ethical bracketing. All those are related because, when I think of transference and countertransfer, that I always have the mental image of when I was in science class and I would watch diffusion, how one liquid would go into the other liquid and counter versa. So that's kind of what I think of when I think of transference and countertransference. The client affects you, kind of like the example that I gave about the different political philosophies. The client helped me understand why a person would think in such a manner, and maybe in the same way, I help them understand a little bit about being more open, being more open to different ideas, etc. I don't know if that was the case. That's just an example of kind of how that works. And then ethical bracketing, is kind of the awareness of how you impact your clients. So when we talk about ethical bracketing, we're talking about you as a counselor, how you are impacting the clients with whatever they're going through. And a lot of times that happens, and a lot of it is unconscious. So keep that in mind. We don't really realize how other people influence us until maybe much later. When we're doing something totally unrelated. A lot of times when I'm out running, I think about different clients and different situations, and I start reflecting, and I'm like, oh yeah, that made a lot of sense. So just keep that in mind. Cultural encapsulated counselor, culturally encapsulated counselor, that refers to a counselor that is really only within their culture, which I hope everybody kind of sees how your culture and other cultures integrate. I know a lot of people had mentioned in the introductions that they work with the Native American population and the rural population. And that's great because part of your counseling and training is working with diverse populations. So I hope that by working with different clients, students, being exposed to people that don't look like you, that come from different backgrounds, that always helps. It's something that I wish more Americans would do. A lot of times we kind of get in our groups and we kind of stay here. Churches are more segregated today than they were in the 1960s. So it's unfortunately not very common to have to have different people that you associate with who are different than you. So I really hope that everybody takes that because as a counselor, you really need to be exposed to different cultures, different dialects, different demographics. That I think that can only help you grow. Cultural values. This is important, especially in a group setting. Different cultures have different values, and that affects how people think. And if I'm coming from a Western philosophy and I'm talking, let's say, to a Spanish client who maybe is more collective and less individualistic than maybe I am, and I'm telling them, you need this, this, and this, that may not, mesh well with where they're coming from. So, keep that in mind. Keep that in mind, especially, that's part of the multicultural training. Informed consent, that's a big one. You should always, if you're working with a minor, you need to always be informing the parent of kind of what group, individual psychotherapy looks like. You should always have a written document that states that they were informed, and you should always be clear about what you're doing, how you're doing it, what goals you want to accomplish, etc., etc. And really, informed consent is not only to protect them, but to protect you, because you want to be very clear about what what it is that you're doing. A lot of times, if I'm doing a group at a school, I provide an informed consent, and I provide an outline of, if I'm doing anger management, I might provide a skeleton or outline and just say, this is going to be our first session. We're going to be talking about what is anger, why anger happens, what is a secondary emotion, what is a primary emotion, how to cope with anger, things like that. Because part of my goal is to have parents talking about this to the children in the house. So if I can talk about that, if their parents can talk about it at home, we're helping each other out. So to me, that's part of informed consent, is keeping parents informed of what the child or the student is learning in a group setting. Malpractice, that deals with really protecting the client as well as protecting the counselor. And it deals with what the standard is. So when I talk about the standard, if I talk to 5 other counselors and I mention a situation and I say, as a counselor, would you have done A, B, or C? And all 5 counselors tell me they would have done C, but then counselor did A, then that tells me that the counselor is not following what would typically be acceptable to the practice. So a lot of times it's important to talk to colleagues. A lot of times it's important to do consultations because of that, especially as counselors in training. Professional training standards, these are the standards mentioned in the syllabus. Psychological risks, it's always important to talk about that. A lot of times people leave that, they don't mention it, but there are risks in any group or individual setting. Social justice, that's part of working for the better good of the client and always having the client's interest in mind. And sometimes that's hard, especially when working with minors. Okay, I didn't want to make this video too long, so I'll conclude there. I highlighted the main points of the chapters. Be sure to read the chapters. Thank you for listening, and welcome to the class.